So the muscles of your neck, and yeah. These exercises can help lose weight.
Body shaming.
Yeah, body
That should not
shaming.
be habit.
You got to lose weight, and it's.
So at least I hope, like, with this, it will open a channel like in.
You know how many people would be suffering? Millions are suffering in our country. Millions. We should give a space where people can put out their stories.
Yes.
Right? Don't you think
Yes.
that would be a great
Yeah,
idea?
that will be great.
So initially, the best thing is a lifestyle modification. As we said, it's not directly. It is linked to weight loss, but there are contrary, studies. But if you're obese, you're like overweight, try to bring it, bring the weight loss, and try to get it under control. Basically, I felt much better once I lost the fat around the neck. So, I was on an intermittent diet, and that's the first thing that I tried, because trust me, I'm a little scared of surgery. So, weight loss was the first thing, and that improves things a lot. Again, not necessarily for everyone, depends on what the cause is. But in general, I feel that if you advance the mandible, you're going to create space inside, and that's going to work wonders, and you feel a lot better. What is the thing that most people know is something called the CPAP, positive airway pressure, and as most people know it like the machine, the oxygen machine. So like,
but I think while traveling and all, that becomes difficult. You'll have to carry it.
Yeah, it is. I think again, it's a mindset. It is a problem, but you need to get some treatment done. So CPAP is where you have nasal, you have nasal and oral components of masks, and where you push air inside, so it tries to keep the airway patent and open. But if you have, again, depends on the problem. Now, if you're just going to use that machine and just going to push air through, sometimes it might require a lot more of pressure. Right? So you connect the dots, identify the problem. If it's the nose, if it's the jaw being back, your tongue being back. So depending on that, it's not just one thing. So I feel it's you employ many methods. So if you have a CPAP is what people usually know, but as dentists, mandibular advancement devices can be very effective. They're recommended as the first line of treatment for mild to moderate OSA. But again, depending on what the problem is.
No, we usually give these custom-made appliances, but there are these over-the-counter things, which like heat and bite and stuff like that. So does it really work? What do you think?
So usually I think custom made appliances are better because a lot of factors are taken into consideration. For example, the patient's fit, everything, the protrusion, everything will be according to the individual
impression and all.
So I feel more than the counter or the top counter ones, the custom made ones are better. That's what I feel.
Yeah, so over the counter, I don't know, there are so many things that come up, and definitely we are here for a reason, right? We need to actually give a device that actually fits perfectly, and how much of protrusion. That's why titratable devices are very important. How much of protrusion is required. So definitely, there's a lot of custom-made things. The things with nasal clips and a lot of things that are coming in. You see a lot of reviews and a lot of things, but I always feel that it should always be custom-made and it should be titrated. It's a therapy. It's not something that you buy off the shelf.
Yes.
It's a treatment. It's this thing. So that's what I think.
And for OSA also, I think we missed saying that there are exercises for muscle strengthening, exercises for the tongue, for the soft palate. There are exercises which can be done, which can strengthen the muscles, which can drastically improve OSA in the patient.
Yeah. So if it's due to poor muscular control, now obstruction can happen at any level. One cause is poor muscular control, especially when you age.
That's why we have more snoring when we age.
Yes. Middle age is the highest. Around, they consider it to be more. So if you have poor muscular control, it's always best to, do muscular exercises. For example, you can, a lot of tongue exercises where you can call tongue popping. No? It's called the tongue pop. And then you can slide your tongue to the back of the throat, from positioning it in front,
From
behind
front
the
to
teeth, and
back.
take it back,
Okay.
and trying to hold air. So basic things like that can activate your muscles. Or you can do some exaggerated sounds like e,
Vowels.
vowels, and mainly trying to engage not just the muscles around your mouth, but also the muscles of your neck. E, and can do things like that. And those exercises can. Yeah. So these exercises can help. They can help with the problem. And
so some patients, they usually come to the clinic with the case of OSA. They usually ask me, like, for how long they should wear the mandibular advancement device. And usually we say that, like, they should wear it lifelong, because the snoring doesn't disappear like
mandibular
that.
advancement devices are going to pull your tongue forward.
So the effect is there only while it is there in the mouth, right?
Yes.
Yeah.
Some people, they have that stress when we advance it, no? So is it advisable to go till the edge to edge bite? Because for myofunctional appliances and all, we take bites like that. So here also, is it the same, or like?
Yeah. Basically, whenever you advance initially, you're going to get a stretch in your muscles. A little bit of aches and pains are definitely going to be there, and I think that's always going to happen. If you're going to wear something, it's not that you're going to be comfortable with it. So initially, it took me 2 weeks to get adapted to wearing the advancement devices. So it's how much you advance. Again, it depends on each case. It's a patient who's in a normal relation, bring it to edge. And the thing is, you need to evaluate if the patient is comfortable in that position. Now, when I advance, I check, you can recline the chair, dental chair also, and the patient is relaxed, and give them a feel as to how much it's advanced, if they can tolerate it. There we take the range of motion, and we take around 60 to 70%. So for each device, which different devices function in a different way. So,
And especially when we talk with respect to class 3 and class 2 cases.
if it's a class 3, that is your mandible, your jaw is forward already, and there's no scope for, in case there is no scope for protrusion, maybe this may not be a good idea. But definitely, if there is a range of motion that is available, you can. But ideally, if your jaw is already forward, and in case of, it's going to be difficult. So that's going to be a problem, and so then we'll have to look for some other solution to the problem. Initially, a lot of studies have been done, but once you use it, the thing is, once you wake up in the morning, you need to retrain your muscles to, to go back to that initial orientation. So you have different kinds of, devices that help with that. In fact, if you do some chewing with a chewing gum, that helps a lot. Or you can use some bite help strips. So you bite on it, and then it retrains the jaw to go backward. Or what I use a repositioning splint. So it gives me back my original bite. So when I bite on them for about 10 minutes, and then the jaw goes back to the original
Like in
position.
the morning, you will.
Yeah, in the morning, once I remove the device, and I.
Okay, that will be of ease to the patient, like.
Yeah, it helps. So once I bite it for like 10 minutes, I feel much better, and that the muscles are back into the original position. So it's not going to make much of a change. Definitely, that's why dentists need to monitor treatment, as we do for our aligner treatments.
Follow-up, yes.
Follow-up
Follow-up
is
is
important. So you need to check if there's some kind of a problem. If the patient, in fact, if the patient has a pre-existing problem, what is the problem? So then a lot of things that you can just check and inform the patient. So it's not that everything is going to work all the time.
And especially when we talk with respect to mandibular advancement devices, I wonder if it will work in cases of nasal obstructions.
Yeah. So this is something that I was facing with, because I have a nasal obstruction. So I was using a titratable, mandibular advancement device. Unfortunately, it wasn't working for me, because mouth was closed. I wasn't able to take air inside through my nose, and a lot of inspiratory, a lot of effort, and I wasn't feeling that satisfactory sleep with conventional mandibular advancement. Conventional in the sense they are titratable, but so that's when I discovered something unique. It's a different solution. It's a device that has an integrated airway inside. So that's something I've not seen in any other device. So it's got an air channel inside. So we design it that it's designed, it's custom made, and it's printed in nylon, and you design it with the air channel inside. So what happens is when you have increased nasal resistance when you're sleeping, you automatically take air through the channel, and the advantage is the airway is going to be stable. It's not like you're opening your mouth. So when you just open your mouth when you sleep, your airway is going to be unstable because again sometimes your tongue can fall back or your jaw can fall back and compound the problem. So I felt that this is something unique. It has a unique channel, an airway channel, and you have a stable airway, and it really helps.
It is going to stay intact.
Yes, your airflow, your airway is more patent. It doesn't make you
strain also, I think, reduces, right, for the patient.
Yes, the strain reduces, and the main thing is it's not that you're going to do a mouth breathing, right? So it's called Dream Vent, okay, and the advantage is it's going to have a patent airway, plus you get to use certain valves. These are positive and expiratory pressure valves. So like the CPAP that pushes air inside. So in this, the valves open up when air goes in, and they close. So depending on the pressure levels, you have 3 sets of pressure levels. So you don't have to protrude the jaw also as much as your normal advancement device. But one thing is, the difference is once you make it, you need to take that bite in with that. There are specialized bite forks that are available and can easily take it, but it ensures that you have enough space for the air channel.
So is there any age limit or starting age? Will it help in pediatric?
Good question. The thing is, for pediatric OSA and all of that, we have our myofunctional appliances.
Yes.
So this is primarily what I use is for adults. So because in pediatric cases, they're growing and the fit is going to keep changing.
Yes,
right?
exactly. Yes.
So it's not going to be you can't keep changing your device.
So if it is the myofunctional appliance, we can trim, and based on the
Yes.
eruption and all, we can do the trimmings.
Yes. So this is a custom 3D printed. It's printed at using SLS, selective laser sintering, and it's printed in biomedical grade nylon.
So it will be exclusively for dentulous patients.
Yeah, you need to have minimum number of teeth, at least 6 teeth. Any mandibular advancement device, you need some teeth for the device to stay. So you need to, that's something. And one thing is, whoever is going for it needs to complete their dental work or prior to doing that, or
Fillings,
decide if they are not, like for example, orthodontic treatment, like some people, for example, a cousin of mine, for him, the orthodontic treatment was not his priority, or his crowding or whatever, that was not his priority. So his priority was, like I explained it to him, see, you need to finish your dental work and then get it done. But for him, his priority was his OSA. He wanted to sleep better. We straight away, went for the device. So the thing is, if you've got any teeth that require some restorations, any kind of treatment that if you need to do some restorations, some crowns or anything, so get all of that done, and then go for the device. Because otherwise the fit is going to change. Definitely these are nylons, so you can slightly adjust the fit at the time of delivery. You can make it slightly tight or slightly loose, but you can't make a drastic change, So that's something you need to tell your patients also. That's what I tell all of my patients. So, and take care of your, you need to brush at night. Yeah, if the first podcast was on
Oral hygiene.
Oral hygiene.
Yes.
So that's going to be the primary thing, because you have a lot of food inside your mouth and you're going to wear this also. That's going to aggravate your problem, and you're going to get decayed teeth, and then you'll have to get treatment done, and the device is not going to fit. Always use the device after brushing your teeth. And these are some of the things and keep it clean.
And what does the doctor have to give? Just a bite will do?
Yeah, so you need to have your upper, now it's a time of digital dentistry, so you can do your upper and lower scans and a bite scan, or you can do conventional impressions. So getting that bite is the right thing, so you need to see whether a correct edge to edge bite,
Protruded.
yeah, and the level of protrusion needs to be judged by the clinician, and that's it. You get the device.
Oh, sounds interesting.
So a lot of things can add up, and it makes the effort. So I think that you should not blame people or some people. I know it's a little off topic, but some people, scrutinize or tell their patients, see, you're obese, lose weight.
Body shaming.
Yeah, body
That should
shaming.
not be how it is. Yeah.
You got to lose weight, and it's only then that your OSA is going to resolve.
And
but
similar is the case with snoring also, because when I travel in trains and all, people, they are very rude to people who snore.
Yeah, they make fun of.
Yeah, you are disturbing my sleep, but they are not
Thing
doing
is,
it
they are not aware of it.
intentionally. Yeah.
They are not in control of it.
So I think people should be a bit considerate when they see
Yes.
this.
it's a little bit of compassion.
Yes.
And being considerate with fellow people. I think as dentists or as medical professionals, we need to be considerate to patients.
Yes,
It's not that, in fact, their weight gain could be because of their OSA, not the other way around. So you just can't tell people you need to lose weight.
Yes.
You're not losing weight. You're not doing enough. So that's
Just
going to make
puts
things,
their morale down. So
that's going to make things worse. So it's about being having empathy towards the problem, getting them to understand the problem and getting them to help them or be with them in their journey. So I think it's also being giving that psychological support and treatment, following up the treatment.
And I feel awarenesses like this can actually help
Yes,
and
definitely.
encourage
Yes.
people.
Yeah.
I really hope it.
Yeah.
I really hope you're able to give
And
out that
it
message.
will give them the confidence to speak in public that even I have snoring.
Yeah.
Many people
Yes.
are psychologically being affected because of that.
And I think George's journey itself is an inspiration.
Inspiration.
Like,
True.
Yeah, because
Yeah,
a lot of people,
it all happened by chance, trust me, because I was like this. I didn't know about it. And people making fun of me, fellow dentists making fun of me, colleagues making fun of me, and it was putting me down. I still remember when we were all sitting together. It was the late evening, and we were all tired after a long day's work. This was abroad, and I just fell asleep, and I started snoring, and everyone made fun of me. And to be very honest, I felt bad, and that's when I slowly started studying the problem. And I earlier visited an ENT for my nose because I was not able to, not able to breathe properly. But I didn't link it to all of this. So it's not that I went for this. So, and trust me. So, and now at this position, I see that, how many people would be suffering. Millions are suffering in our country. Millions. I think we can make this world a better place if we just give this awareness to people.
Yes,
Yeah.
definitely.
At least they will start seeking treatment for this. That is very important because they think, okay, snoring is just normal.
Yeah, that's what.
Yeah.
It's not like
Or
other
if-
diseases where people are aware. They should seek treatment. This
Yes.
one, they just carry it.
Just like mental health have so much awareness these
Awareness.
days, I think even snoring requires.
Yes.
I'm happy that mental health has awareness because trust me, I
Yeah.
think mental health is is just something that people don't discuss much.
Particularly
They're
in
very
India, right?
hesitant
Lot
to
of shame.
speak about.
And coming back to sleep, who doesn't like to have a good sleep, good sound sleep? That makes a lot of difference. Like, if you're sleeping for 6 to 7 hours, a good sound sleep means
Yeah,
Like,
and,
lot of things will
and
fall into
letting your
place.
partner as well to sleep peacefully because we don't disturb them with the sound sleep.
I've been very irritated with her many a times. And sometimes when you get up and you're not having a bad day, you get irritated. I get irritated, at home. So it's all,
interlinked.
Yeah,
Yeah,
it shows everywhere.
yes. And once you connect the dots is when we actually, you have an epiphany that, my God, this is a problem.
Yes, that's what.
So I just hope that
Actually, the importance of sleep has to be mentioned as well.
I hope, such discussions, come up more and more people get to know what has to be done, what is going wrong, rather than, mocking the people who does know.
because for certain there are a lot of similar stories
yes.
stories to be told. So
Yes,
at least I hope, with this, it will open a channel, it will open a
Yeah.
like
well, I think we should give a space where people can put out their stories.
Yes.
Right? Don't you
Yes.
think that would be a great idea?
Yeah, that'll be a great idea.
You know, share your sleep stories.
Sleep story.
Yeah, that itself, will motivate a lot of people to.
Yes,
start the
let's
journey.
do it.
Yeah.
You know,
Let's do it.
let's do it, and let's
Yes.
get people on board, and share your story, because I think people should know how grave this problem is.
Yes.
And many people have a lot of silent heart attacks.
Mhm.
People die. It's just that we don't know the cause, right? All the general public, what do they see? Oh, he had a heart attack. He was 62. So all of this can cause, it reduces life expectancy. You have
Actually,
OSA.
reading any literature on OSA, it ends up in stroke. The end result is, actually the brain is deprived of oxygen at that moment when you're sleeping.
So depression, stroke, heart problems, and it's all linked, and additionally to the stresses of every day.
Every day, yes.
The world has come to a rat race, and everyone is running, and that's an additional stress, and all of this together, I think it's going to this thing. So you should do that. I think you should, encourage people to bring out their stories
them
and
speak,
open up and let
Yeah,
them speak up.
open up your sleep stories.
Yes. So
You should give a platform for that.
yes. So thank you guys. It was fun. It was fun
Yeah, it was
discussing
fun.
this.
Thank you.
And,
We could also learn a lot,
Yeah, it was very
Yeah.
informative.
Informative,
and,
yes.
Yeah, and it actually gives confidence to many people who are watching the show, I feel, to seek help for if you have snoring, if you have OSA, like people who might be still thinking it's a nightmare.
Yes.
They will now step out and seek help for such
Yes.
underlying conditions. They'll go to a dentist, go to an ENT, and ask for help. It's very informative, and very happy to be a part of this discussion.
Yes.
So
Likewise.
keep it up, Jim, and keep rocking.
Yes.
So it was a wonderful session. I'm happy George was able to share a lot of insights, and it was helpful for all of us. And I'm
Yes.
happy you both joined us for this very insightful session. And I believe it was helpful not just for dentists or people who are watching. It is actually inspiring a lot of people out there who is actually going through this condition. And thank you for watching the show and for supporting us. See you in the next video.